Hi, my name is Chelsea Stevens. I am a nursing student with the Accelerated Nursing Program, Bachelor of Science at Nebraska Methodist College. I'm set to graduate July 2023. This presentation will be about my capstone and the educated citizen. So, the public issue that I raised awareness and research during this program is teen pregnancy across Nebraska. Why teen pregnancy is for advocacy, alliance, and change. For personally, I have connected to this because I have a passion to work with kids. I also have a passion to work in like labor, delivery, mother, baby, and this topic interacts with all of those uh, places I would like to eventually work as a nurse. And as well, in the clinical setting that I've been in, as well as work related, I have actually met many patients that have been pregnant, are pregnant, or find out they're pregnant, and they don't have the support system of sex education or what to do when you're pregnant, what's contraception. And I think that it is very important to learn about those things, especially in those young teenage years. So, some facts that I've learned about Nebraska: for every 1,000 births, there's about 14 of them are to teens. And that may not seem like a big number, but in Nebraska, we have about maybe 500,000 teens, like according to the census. So, cut that in half for just females. That's 250,000 females that could potentially become pregnant in Nebraska. Not only does it affect the mom, it affects the unborn child, and it can lead to longer effects later in life, as well as continued pregnancies that are unplanned. The biggest thing I learned during my research is that Nebraska does not have a law that requires mandatory sex education to be taught to these teens in the public school setting, which I found astonishing just because I'm from California and it is mandatory there. There are states that make it mandated that sex education is taught, and those states show a decrease in the number of teen pregnancies because teens learn to have protected sex, or they know how to get contraception, or what abstinence is. And I think that the teens here in Nebraska could definitely benefit from having it taught in the education system. So now I'll be talking about the educated citizen, which I've experienced over the last year with Nebraska Methodist College. So the first one is the effective communicator. So this experience that I'm going to first talk about was in the ICU. And in the ICU, there are a lot of patients that unfortunately pass away. And I had a classmate who experienced death for the first time. And I kept observing this classmate, and I could tell something was different. And I wanted to make sure they were okay. And I communicated with my classmate, communicated with my instructor. And after this patient eventually did pass away, I pulled my classmate aside and we talked for over an hour about death and dying and how it can be beautiful, but it can also be so unreal. And if you haven't experienced it before, it can be hard. And what I learned is that I have to have the ability to advocate not only for my patients, myself, but for my peers, because paying attention to my peers will make the teamwork effective. And I know I would want somebody to have my back or to make sure I was okay if I was going through a hard time, especially in nursing. And how I can use this ability with teen pregnancy is I can advocate for my patients. I can be that communicator for the teens, the parents, and raise awareness of what needs to be taken care of, the support system that they need. So the next one is the experience two as an effective communicator. I was also in the ICU, had a patient who was on a vent for 2 weeks, wasn't responding to anything. And I had the opportunity to see this patient respond for the first time by opening their eyes. The way I was an effective communicator is I talked to my patient as if this patient could talk back to me. There was no words coming out of her mouth, or it was just an eye gaze that I would get. I talked through each procedure, each medication. I talked to the family members and made sure that my voice was educating the patient and educating the family members. I learned how much involvement needs to be in there with each patient. Each patient has a story, and we're human. We need that social connection. I can use this to communicate with teens about protection, prevention, the support, and how to ask for help, because it's just talking. It's just saying, hey, I need a friend. So then the next one is the reflective individual. And the experience I had was in the very beginning of this program, and I had learned my skills, learned my textbook, and I was nervous. I was a nervous wreck, and I didn't get the experience that most of my classmates got because my patient, unfortunately, didn't want to be bothered by anybody. So I got to work with my nurse and the other patients she had, and she walked me through step by step what she was doing, asking me questions. And what I learned that day and reflect back is that I know my stuff. I found the confidence that I needed to feel like I was a nurse. Now, coming from that time in the beginning of the program to now, I mean, my confidence is definitely up there. But each day I've learned that there's always something to learn. There's always time to ask questions. And I can teach that to other healthcare professionals and to teens and parents, reflecting that I have knowledge, but I also have questions that I may not have the answers. And I will find somebody to make sure we get those answers and to use the skill set that I have to interacting with teen mothers. Now, the next experience is, as a reflective individual, is it happened recently at the end of the program. I unfortunately didn't get the preceptorship that I originally wanted, and I didn't get any of my choices. And I kind of was very frustrated, and I felt cheated out of my education, and I was trying to be positive about it. And I kept talking to family and friends, and I just said, keep an open mind. You may like it. Let's just see how it goes. And I learned from this experience that I like to go with the flow. I loved learning the unit that I did. I had a great preceptor. She has taught me so many things, and I can use this ability of keeping that open mind is to have teen mothers keep an open mind, parents to keep an open mind, because when you add a child into the mix of life, you're going to have some hard days, but they're going to be rewarding days. So I can use this experience of teaching how to be open mind and the open opportunities that everyone can have. The next experience is my change agent experience. And this first one was at a rehab center where I had used my previous experience as a CNA and from interactions I was having with the healthcare professional team, that the patient that I was working with was not acting like in their normal state. So I advocated and voiced my concern that something was wrong with the patient. And because I did that, that patient was taken care of by the doctors and the nurses. And I actually helped the patient stop worrying about going back to the main hospital because they were petrified of that they wouldn't make it out. And being a change agent, this experience taught me how to use my listening skills. I listened to my patient, I listened to the nurses, and I used all the information that I gathered to make sure that my voice was being used as their voice. Advocacy is a big thing, and this would also allow me to help teen pregnancy by speaking up with policymakers and government officials and making changes in the education system and health system of helping teens prevent pregnancy or support them if they do become pregnant. My next change agent experience was with a patient that I met that was getting a procedure done to have a biopsy done on a tumor to rule out cancer. The patient was, it's just sad is the word I'm just going to use. She walked into the procedure room and I knew like she needed a hand, she needed to talk, and come to find out she was a mother of 6 and she was scared that if she had cancer, her family wasn't going to have her anymore. I've lost family members to cancer and it's been very detrimental to me, but I listened to her concerns and I listened to her values and her beliefs. She asked me to pray with her. I prayed with her. I don't pray every day, but she asked me to, and it kind of put me out of my comfort zone, but I didn't care. I wanted to be there for my patient. So we prayed. I gave her some advice to live each day as best as she could, and I became a change agent because I listened. Just like my experience before, I listened to my patient, I got out of my comfort zone, and I valued her belief system. It's something big that we do as nurses. And I can use that the same way as working with teens. What is their belief about pregnancy or protection? What do their parents believe? How can I connect those two, interact everything, and help these teens and listen to them? So my conclusion, the implementation of like sex education and safe sex practices into public school settings needs to be implemented into the school system in Nebraska, because it not only will slow the numbers of pregnancies, it's a step in the right direction. Teenagers, just like adults, can make mistakes. But if they're taught these things in school, this is something that they can use as tools as future parents. And my recommendation is that we need to combine all the efforts of government officials and policymakers, healthcare providers, educators, parents, teens, and come together and teach these kids how to prevent this and protect themselves. They are our future, and they deserve to have the best opportunity to be part of our future. This can not only save the lives of the mothers, but also the lives of the children. And I hope to see some change in the near future for the state of Nebraska and the rest of the United States. These next 2 slides are just my references I used through my public issue project, and I hope you got some great information and learned from this presentation, and thank you so much for listening.